have a number of patients who come to us and inform us that they have been looking for aquatic therapy for a couple months and are happy to see that we have a pool to use. And they love it. They really have a good time.
All of my patients really enjoy the exercises in the water for various reasons. The heated pool, the water helps assist with exercise, and the patients are happy in here. This type of pool is ideal for our patient population that we see, which is mostly orthopedic, post-op patients, some neurological patients. We utilize the swim current for resistance training, endurance, balance activity. So it's been very beneficial up to this point.
LPT is the first facility where I've worked that has a swimming pool. And it's a big reason why I chose to work here, in order to gain experience with aquatic therapy.
You're more useful as a physical therapist because you can exercise with patients in the water and then progress onto land, get them back to work sooner, get them back to their activities of daily living sooner.
The fascinating patient I've been treating in the pool is a patient who had rotator cuff repair.
I've had surgery on my shoulder, and I need physical therapy to regroup.
We had been using hot packs and stretching him, but we just got to a point where we couldn't get him any further.
I used to warm up with heat and stretching, and I found that the pool, it saves time, and it does a much better job of stretching me out.
Affinity is a joint venture between Good Shepherd and Lehigh Valley Hospital. We do pre-surgical and post-surgical work at Affinity. Sometimes the referring doctors will send them here for, say, a knee replacement before they have their knee replacement to make it as strong as they can, which makes their rehab easier.
Keep your arms at the side and kind of bicycle, but try to keep your body nice and straight and tall. Having an on-site pool, I think, increases your marketability in terms of not only physicians and the patient population, but also the insurance community.
When we built the facility, we knew that we wanted to have aquatics, as part of our program. We knew that aquatics were going to set us apart from some of our competitors. We're located in a basement here, and we had some concerns about how we were going to get the unit into the basement. What we liked about the endless pool versus the other units that we looked at was that it did come in pieces and was able to fit through the doorways and down the steps. And we also liked the price. It was actually less expensive than the other 3 units that we looked at.
The company was excellent as far as allowing us to design the pool how we wanted. We had all the options of where we wanted to put things, what actually we wanted to include in the pool, and that was all our choice and our design. We did look at different pools and different companies, and this is the one that we were most happy with.
The water only comes at you at a certain, like a block of water coming at you. So if you get tired, you can just step out of the water. We also like that because if you need to work a shoulder or a knee, you can step to the side of the current and then take your arm and get the resistance that way.
We elected to put the swim current at our 52-inch level because that is where most patients do a lot of the water walking, and they can walk against the swim current, at varying resistance.
Sometimes I'll use the bar as a stationary position without the current itself. Sometimes without wanting to turn the current on, and I can do some kicking just like this. My wife uses the bar a lot when she's doing water aerobics with her legs.
The pool maintenance is very easy. On a daily basis, we check the chemicals. Recently, we did drain and refill the pool, and we had no problems at all.
We check the pH, we check the chlorine count every day, and that's basically the maintenance on the pool. Very, very minimal maintenance.
Once you get used to the standards, you just come in and check them and go on with your day, and it has been very easy. Patient attitude is a lot better, and their compliance is really well. You rarely have patients cancel for aquatic therapy.
I enjoy my job as a physical therapist.